Hi there, welcome. I'm Dr. J. Michael Bennett. I'm a Board Certified Orthopedic Surgeon who specializes in sports medicine and minimally invasive surgery of the shoulder, elbow, and knee. Today, and welcome to the Whiteboard Series, today we're talking about shoulder popping. A lot of patients come into our office complaining of painful popping and clicking within the shoulder joint, and we just wanted to go over some of the basic causes of painful popping and clicking in the shoulder joint. First off, it's key to understand that shoulder popping and clicking is normal potentially in a majority of patients, particularly if you have it on both sides. A lot of patients' shoulders pop and click on a daily basis just like your knees pop and click. The key difference here is whether or not it's painful. If it is painful and it is a new onset, meaning you just had it a month ago after sliding and falling down on your shoulder, then that's a little bit more of a serious situation which needs to be evaluated by a specialist. If it's just popping, clicking that you've had as long as you can remember, then I wouldn't worry about it. So if there is any question either way, please seek a professional for further evaluation or recommendations. So the first thing we want to discuss today is a painful pop in the shoulder, particularly brought on by a traumatic incident or somebody that's fallen or somebody that's grabbing something heavy. And that patient will usually present with a painful pop, pain in the shoulder, as well as inability to raise their arm above their head, and significant pain when sleeping at night. So first thing you want to think of with that particular scenario is a rotator cuff injury. So these are some basic drawings of the shoulder. Shoulder consists of the ball, which is the humeral head, and the glenoid, which is the cup. Surrounding this humeral head is a series of muscles called the rotator cuff musculature. There's the supraspinatus muscle up top, supraspinatus, subscapularis in the front, and then there's the infraspinatus in the back, and the teres minor. When they all come together, they form a cuff around the ball and socket mechanism. So these are the rotator cuff muscles and tendons all converging around this ball, which is the humeral head. So this is the cuff. So what we're going to talk about today is a painful pop after a fall from outstretched extremity or after lifting something heavy. And the inability to raise their arm above their head. So what that usually means is that this tendon may be involved. This is the supraspinatus tendon, so you can have a tear in that tendon where it inserts right there at the bone, and when that happens, the rotator cuff can act like almost like a rubber band because there's elasticity in those muscles. So those muscles want to go back, they want to go backwards, okay? They want to retract. So that once that muscle and tendon is detached from the bone, your ability to raise his arm up above your head is significantly diminished. So it's significantly painful and weak. Sometimes patients will present with a drop arm where they just kind of barely bring it up and then it drops down to their side. That is definitely an indication of a possible rotator cuff injury, and it's recommended to get it evaluated. If you would like to contact our office is 281-633-8600. If you have any further questions, please feel free to visit our websites at www.orthopedicsportsdoctor.com or www.jmichaelbennett.com. Thank you very much.